All right, let's do the mouth. So the mouth is fairly complicated if you're just looking at a regular mouth. So let's try to break it down. Around the mouth, we have a fold which goes from the nose would be here and it goes all the way around like so. This is called the nasolabial fold, and that's one of the most important landmarks really on the face. I was a bit torn of including it here because it's technically not the mouth, but it's still going around the mouth.
Yeah.
So very important. Then we have the philtrum, which is also technically not a part of the mouth, but super important in order to, to actually get the shape of the mouth, because it goes into this triangular shape, which you see here. Around the lips, you're seeing the vermilion border, which is sometimes you're seeing this as a very clear and sharp line. Sometimes you're seeing it as almost just as like faded off.
Yeah.
And in our sculpt here, it's an older person, so you're seeing it as a fairly faded line. But if you're looking at younger people, you can often see a very, very sharp line there.
This could also sometimes be confused for something that's sharper than it actually is when people are wearing makeup, just because that makes it more prominent. It looks like there's a bigger plane change than there actually is. There are other tricks as well, like some people put like a little highlight on top of their lip to make that top part of the vermilion border stand out more. So it's just something to be aware of.
It's funny how makeup has such a big impact on how you perceive the shape.
Yeah.
It's kind of like you're faking it with like poly painting, or you're painting some spec R just to like emphasize where you want certain things to be.
Yeah.
And then we have a muscle going around here, which is not a sphincter muscle.
Yeah.
It's a collection of multiple things, which means you can actually close your mouth, but we basically have a shape which wraps all the way around here. This is not actually orbicularis oris. It's more, there's fat on top of it. So in this case, you wouldn't see the muscle directly, but the fat pad would still follow the general shape of it.
And this is very, like, there's a lot of variation when it comes to the skin and fat that sort of lies on top of the orbicularis oris, because like if you want that more broody, manly look, you would emphasize that a lot more. You would like add a lot of volume down there. For women, maybe you would try to cut that in, make it more concave instead of convex. So there's a lot of individual variations. So you should really, look at your reference when you're trying to sculpt this part.
Yeah, that's actually why we're sculpting more an older face here, because you can actually see them. If you were sculpted a baby, you would barely be able to see any of this.
Yeah.
It would be such subtleties that it would just be a hint of them. So if you're turning somebody from old to young, it would basically be that you're smoothing off whatever shapes you might have there. And then we have the parts of the lips as well. We have color coded them so that it's a bit easier just to see. The way I like to think about the top lip is there are kind of like three parts, or two parts here in color. We have the middle part, and then you have two parts to the left and right of it. In some people, you can see this as a very clear distinction. In some people, there's basically nothing.
Yeah.
But you can see here that there's still plane change. It still goes out more, and this is a bit flatter. So this middle part is a bit rounder, and the other parts are a bit flatter. And if you were to look at your reference, which could just be a mirror, then you would see that there's definitely some plane changes going on here.
You could also check out Anatomy for Sculptors. They also have a very nice explanation of sort of how the tubercles of the lip are flat on the side, on the upper lip, and more round on the lower lip. It's just our representation here is basically just the way we think of it. It's like it's divided into these like round shapes that sort of meet, and where they meet, there's a little bit of a plane change.
Everything we're talking about in this series is all about what helps us sculpt the face. This is not a pure anatomy lecture. Also because anatomy of the face is so tricky, because when it comes to the anatomy of the body, you have a clear pectoralis major. You see the muscle, you see the striation for it, and you know how to work it out and all that. But muscles of the face, they're so damn subtle, and they're mainly covered by a lot of fat and skin on top of it as well. You can see the muscle in certain places on really old and really skinny people in certain expressions, but in general, you really, really can't see them. And you sure as hell can't really work them out either. You don't really do face exercises like you would with the body. And then we have this shape which goes around here as well. This is one of the key things to making really appealing lips. And if you're a beginner, you probably haven't sculpted in this shape. There is like this really beautiful overlap, which happens in this area and creates this fold here as well. And if you really want appealing lips, I think it's so important just to get this shape here right. Let's disable color so you can see it better. You can see that it's a pretty clear shape which is going on here. Super important to get right. So with everything else, proportion is different among people, but basically all people would have every single one of these elements. So keep this in mind whenever you're sculpting, from a baby to an old woman to whatever it might be.
Yep.